So cancer cells are basically those friends who show up to the potluck, eat everything, then complain there's no dessert. They multiply faster than your laundry pile, push everyone else around, and have absolutely zero chill. But here's the thing nobody tells you. These gluttons need food, like an obscene amount of food. We're talking competitive eating champion levels of consumption. And scientists just had a brilliant idea. What if instead of fighting cancer head on, we just cut off its food supply? Well, it's not that simple. Nothing ever is. But this approach is actually changing how we think about cancer treatment. See, cancer isn't just one disease playing dress up. It's hundreds of different diseases, all wearing the same name tag. Cancer cells are speed demons, while your normal cells are responsibly pacing themselves. Cancer's out here sprinting like it's trying to catch the last train. They literally hide from your immune system like that friend avoiding eye contact when the bill comes. For decades, we've thrown everything at cancer. Chemotherapy, basically poison that hopefully kills cancer faster than it kills you. Radiation, frying the bad stuff. Surgery, just cutting it out, very subtle. But cancer's evolved. It develops resistance like it's leveling up in a video game, and here's the kicker. Most treatments can't tell the difference between cancer cells and healthy cells. Normal cells follow the rules. Cancer cells are out here running red lights, ignoring speed limits, and parking in handicapped spots. Scientists have been basically playing whack-a-mole for years. Cancer dodges. It's exhausting just watching. But let's talk about cancer's real weakness. It's an absolute pig when it comes to nutrients. Cancer cells consume sugar like a kid unsupervised in a candy store. Normal cells eat a reasonable amount. Cancer? It's hoarding glucose like there's an apocalypse coming. Scientists call this the Warburg effect, which sounds fancy but basically means eat sugar like there's no tomorrow. They need glucose, oxygen, amino acids, and a blood supply. High maintenance doesn't even begin to cover it. And when tumors can't get enough blood supply, you know what they do? They grow their own blood vessels. Yeah, they hijack your body's construction crew and build themselves a personal highway system, the Audacity. It's like a city that's so entitled it builds its own roads just for supply deliveries, except the city is trying to kill you. This process is called angiogenesis, and it's basically tumors, saying, if you won't feed me, I'll feed myself. These blood vessels wrap around the tumor like cables, pumping in everything it needs to keep growing. Cancer's running a full metabolic factory converting fuel into growth. Efficient? Yes. Evil? Also yes. So finally, scientists had their light bulb moment. Instead of fighting cancer's symptoms, why not just unplug the whole operation, cut the supply lines, and watch it crumble? First approach, blocking blood supply. Because if you can't build roads, you can't get deliveries. These drugs literally stop tumors from growing new blood vessels. It's like putting up roadblocks on every highway leading into Cancer City. No blood vessels, no nutrients, no party. Before treatment, tumors living its best life with full room service. After, isolated, confused, and starving. And the tumor? Oh, it's reaching out desperately for those blood vessels, like someone trying to grab the Wi-Fi signal but nothing's connecting. Watching cancer struggle is surprisingly satisfying. Second method, cutting off metabolism, going straight for the fuel supply. Some treatments block cancer from processing glucose entirely. Cancer's sitting there with its mouth open, food's right there, but it can't eat it. It's like watching someone try to eat soup with a fork, frustrating and futile. Factory closed. Fuel locked down. Energy output zero. Cancer's throwing a tantrum, but nobody cares. Cancer tries to get creative, switching between different fuel sources like a desperate student raiding the fridge at 2 a.m. But treatment blocks every attempt. Sugar, blocked. Protein, blocked. Fats, also blocked. Good luck. Third strategy, targeting the tumor's neighborhood, making the environment so hostile that cancer can't even function. Scientists are literally remodeling the area around tumors, changing the conditions from cancer paradise to extremely unwelcoming wasteland. It's like gentrifying cancer out of the neighborhood, which is the only acceptable form of gentrification. Think of cancer as an invasive species. Change the ecosystem and suddenly it can't survive. But here's where it gets really interesting. What if you combined all three approaches, block the blood supply, shut down metabolism, and make the environment hostile? Cancer doesn't stand a chance. Now, to be clear, this is all still being researched and tested. Science takes time. Some approaches work, some don't. But some of these therapies are already being used in hospitals right now. Real patients, real results, not just some distant future fantasy. Of course, nothing's perfect. Cancer wouldn't be such a massive problem if it was easy to defeat, because cancer is smart, annoyingly smart. You block its glucose supply, it finds alternative fuel sources. It adapts faster than you can say remission. It's like that villain who always has a backup plan. Plus, different cancers react differently. Lung cancer might shrink with this approach, while breast cancer just shrugs it off. There's no one-size-fits-all solution. And here's the tricky part. You need to starve cancer without starving healthy cells. It's a delicate balance. Go too hard and you hurt the patient, too soft and cancer survives. Walking a tightrope while juggling chainsaws. Some cancer cells are just naturally resistant. They show up already wearing armor like they knew this was coming. Research takes years. Clinical trials take years. Testing takes years. Everyone wants instant results, but that's not how science works. It's slow, methodical, and occasionally disappointing. Progress happens one step at a time. Not exactly inspiring, but it's the truth. The good news? All these different research areas are starting to connect. Metabolism studies, blood vessel research, immune therapy, they're all pieces of the same puzzle. And slowly, the picture's getting clearer. So what does all this mean for the future of cancer treatment? We're moving toward combination therapies. Immunotherapy teams up with metabolism blockers. Blood vessel blockers work alongside chemotherapy. It's like assembling the Avengers except for cancer treatment and hopefully more effective. Doctors will have more tools in their toolkit. More options means better chances of finding what works for each patient. Personalized medicine is the goal. Your cancer gets analyzed, and you get a treatment plan designed specifically for your situation. No more throwing random treatments at the wall hoping something sticks. Every breakthrough helps scientists understand cancer's weak points better, and the more we know, the harder we can hit it. So let's recap. Cancer needs massive amounts of nutrients. It builds its own supply lines, and scientists figured out they can starve it by cutting off those supplies. Blood vessels, metabolism, environment, attack all three and cancer's in trouble. Will this cure cancer tomorrow? No. But it's giving us better weapons in a fight we've been losing for too long. And that's how science slowly but surely figures out how to beat the worst diseases humanity faces, one stubborn discovery at a time.